Let's talk to Katy MacLeod from the Scottish Drugs Forum and Alex Stevens, Professor in Criminal Justice, Director of Public Engagement, the Faculty of Social Sciences. Katy first. What can you tell me in the audience about the use of GHB? It has been used by the most prolific UK rapist. Tell people about the uses of this drug, please.
Yes, indeed, and we're certainly aware of GHB and some of its derivatives being used for that purpose. To be honest, we see other drugs quite commonly used for drug-assisted sexual assault as well. I think we have a twofold issue with GHB, so that is a strong issue, but equally we have a lot of recreational use as well, where people might be using in smaller amounts and sometimes people's use can escalate, and we can see dependency issues as well, and certainly things like overdose and things like that can be an issue as well, where people have intended to use the drug. So it has all these facets to it.
In terms of recreational use, how is it used? What is it used for?
Probably the most sort of common usage from our research is around the chemsex community. So this will be men that have sex with men, using for sexual enhancement and pleasure really as well. They'll report more pleasurable experiences, and we do see some people have problems that might come from that as well. And
in terms of being a Class C drug and the availability of this drug, where do they get it?
I mean, it's quite similar to how we purchase other substances. So you can see everything from buying from people they know, peers. It can be online purchase. So I guess any class of drug at the moment is pretty accessible in Scotland and the wider UK.
If you were to think about an intervention, obviously, drug use and drug misuse is part of being human. Raping somebody is not part of being human, nor drugging them against their will is being part of being human. But in terms of an intervention to decrease the use of GHB, what works if it's needed?
Yeah, I think, when we're thinking about what prevents drug-related deaths, it's access to information, whether that's about information about the drug effects, also about some of the risks, like things like making people's awareness of issues such as spiking is really important as well. Really good access to treatment and support for people that have dependency issues. And in terms of thinking about the drug-assisted sexual assault side, we need to be thinking about people's experiences of reporting rape and sexual assault and making sure that prosecutions are increased in that area, because actually that's a massive issue as well, and it might stop people coming forward as well that have experienced that. So there's really complex issues when we start looking at the whole situation.
Yeah, and one of the things we've looked at a lot on the radio is that many of these drugs are cheaper than alcohol. Apparently you can buy some of these drugs very cheaply. But to go back to the chemsex element, so you're talking about this is principally men using this for sex with other men, and it heightens their pleasure, and they just buy it cheaply somewhere, do they? And how much is this stuff?
I mean, it can vary in price. It's certainly not a particular expensive drug. I think it's really important what you highlighted about the alcohol use, because that is a major issue that we know with GHB, that when it's mixed with alcohol, it's a particularly dangerous combination, and it also means people are more likely to take much more GHB doses as well, and people's ability to make sense of what doses they're taking really can go out the window as well. So, we need to be thinking about not just one drug, but actually how people use drugs in Scotland.
Katy, can you stay with me? I'll bring in Alex Stevens, as I said, Professor in Criminal Justice. Alex, thanks for talking to us. We obviously had the mum earlier on, and she is distraught that this hasn't been straight to Class A. So just spell out for me in the audience, moving something from Class C to Class B, in practice, what difference does that make?
In practice, it makes very little difference whatsoever, because the maximum penalty for Class C is the same as it is for Class B, so up to 14 years imprisonment for supply of both those substances. And we know from experience with other drugs that have been reclassified that it doesn't make any difference to the risks or the levels of use of those drugs. So, for example, when cannabis was downgraded from Class B to Class C, that didn't make any difference to its use, nor did it make any difference when cannabis was put back up from C to B. My fear is that the government's decision to reclassify GHB is just a symbolic attempt to show that it's doing something, which isn't actually going to have an effect in saving anyone's life.
Are you saying that the reclassification of a drug practically has no effect on its use?
Yes, I'm saying that. And the Home Office's research has showed that in the past, that the levels of punishment that we threaten people with tend to have very little effect on the levels of use. For example, you mentioned yourself that the biggest illegal drugs that are killers in Scotland are Class A, and they are still in circulation despite having that higher level of penalty towards them. And that's another concern I have with this reclassification. There's a drug death crisis in the UK at the moment. Over 1,200 people died in Scotland last year with drug-related deaths. And the government is spending legislative time on fiddling with the classification when it's refusing to make the legal changes that are necessary to save people's lives, such as allowing the Scottish government to open safer injecting facilities where people's lives could be saved.
Okay, well, Katy, are you in the same boat then? You think this is just tinkering? This is governments looking as though they're doing something, changing something from C to B when it should be A. In practice, it makes no difference to the consumption of this drug, and it needs a different intervention. Is that what you're saying?
Yes, and certainly in terms of the work that I've done with men in the area, they often will say that legislation makes absolutely no difference to their use. We saw that when things like the Psychoactive Substances Act came in. We spoke to this particular group as well, and 74% said that would have absolutely no impact on their use from that population that are engaging in chemsex. So that to me is telling us something. And if we go back to the actual recommendations that were based in the ACMD letter about this, legislation was one part of it. There was many other parts, and it was things like education for treatment staff, improving treatment interventions, and getting better information and support to people at risk of harm. So that's what I feel we need to be doing.
Well, listen, I appreciate your time. You're both experts. So before you go, Alex Stevens, in 5 or 6 words, if you were in charge of any country, the way to get people off drugs, or one of the ways would be what? To do what?
Reduce poverty. There's massive inequality in the drug-related harms in Scotland. It's concentrated in the most disadvantaged communities. If we reduce poverty, especially child poverty, we'd make a big impact in the future in reducing some of these harms. Alex
Stevens, Professor in Criminal Justice. Thank you. Katy MacLeod, Scottish Drugs Forum. If you were in charge of a country and you wanted to get people off drugs, what would you do?
Absolutely improve our poverty, our deprivation, and access to treatment and support when people need it.
Okay, Katy, thank you. Katy MacLeod, Scottish Drugs Forum, and Alex Stevens. Utterly fascinating. Both saying that reclassifying a drug has no effect on the consumption of that drug.